Thank you very much for giving us this opportunity. My name is Michelle Kern, and I've taught 2 classes in ceramics as a part-timer for College of San Mateo for 9 years. Before that, I worked as an artist, teacher, and arts community organizer in the East Bay for several years. I've been fortunate to be able to work in a field which is my passion. The area which has not worked out so much has been with health benefits, which are notoriously elusive in creative fields. I had hoped the move in 2006 to a college environment would make me eligible for benefits that I might find affordable, but realized after I was hired as an adjunct at College of San Mateo this was not the case. San Mateo Community College did not have a plan that was accessible to a part-timer, except for a small medical stipend to reimburse some costs if you had a medical plan from elsewhere. My husband also works in fields that don't offer health benefits. So like many other artists and teachers in the Bay Area, I just hoped nothing bad would happen to me and went without insurance. Right after I started work, a small cut on my foot blew up into an infection that turned into a red streak going up toward my ankle. I hemmed and hawed trying to soak it in hot water and put neosporin on it, even though I knew that a red streak was a bad sign, until my mother insisted that I go to the ER at San Mateo County Hospital. I was checked in, and I let them know that I didn't have health insurance. When the doctor came in to see me, he demanded to know why I didn't have health insurance. He told me that was irresponsible of me, since women my age need annual health checkups and cancer screenings. He asked how someone who said they were a college teacher could possibly not have health insurance since it's a respectable job. I started crying and said part-time college teachers don't get health insurance at my school. So the cellulitis in my foot was on its way to a nasty blood infection. But 1 tetanus shot and a prescription for powerful antibiotics later, I was on the mend, but also on the hook for a bill for $1,000 out of pocket for the visit. So a year or so later, a car came crashing into our truck while my husband was pulling out of a parking lot. The seatbelt saved me from a life-ending event, but the belt crushed into my sternum, and the impact and terrible pain made getting out of bed or walking too fast a real misery. The other driver turned out not to have not have audio insurance, so I couldn't bill her either for help. So I didn't go to the hospital. For the month, I hid the pain from my students while teaching my classes, unwilling to go to the ER and face another expensive bill for something that wasn't infected or breaking off. So after that, I drove myself very slowly and became the world's most paranoid and careful driver, and hoped that someday I could get health benefits. When Obamacare expanded last year, I left the chance to finally get access to health insurance. The San Mateo Hospital ER's doctor's words about female-related cancers kept echoing in my head. Each year I got further into my 40s, and I was getting more terrified that I could discover something that I couldn't even afford to treat. I signed up for Covered California, deciding to get a Kaiser Silver plan, as it seemed the fairest balance between affordability in my age bracket and smaller deductibles. I wanted to have real coverage in case there was something seriously wrong with me, and I knew from the news that you could still go bankrupt from medical costs if you had bad insurance coverage. So I plugged in my income and my husband's income, hoping that I'd be eligible for some kind of subsidy, as the plan I had selected was over $400 a month. But I was dismayed to find out that our combined income put us over the federal poverty guidelines for 2 people, even though living on $64,000 in the Bay Area is hardly rolling in it because of the high cost of living. If I divorced my husband, I would get a very good subsidy, but I'd lose my husband, whom I love. However, on the bright side, I applied for the part-time medical stipend, the $600 per semester I'd never been eligible for since I didn't have a health plan before. The bad news was that $600 only covered a month and a half of my premium bills. However, I did find that I did not have cancer, so there's that. Thank you.